My first advice is get as much training as you can. That's the most important thing. That's the sort of the linchpin without which nothing else matters. If you're not really, really good, not only with the surgery, but with the patients and with handling people's expectations and handling their needs, you're unlikely to succeed. I don't know how someone can finish just a residency and go right out and handle cosmetic surgery. The practice is so multifaceted, dealing with patients in pre-op, dealing with post-op, doing the surgery itself. It's just a more complex business than a lot of other medical practices are. I think that, physicians are overtrained, and I think that they need to be. Board certification is sort of the cherry on top of that overtraining. In more practical terms, it's hard to get hospital privileges without board certification. And the board requires either hospital privileges or working in an accredited surgery center, which itself generally requires board certification. So it's not just the icing on the cake, but a requirement. Patients expect that these days. The days of the general practitioner are over. Medical boards, patients, hospitals, everyone expects board certification these days.